Right now I'm working on my manual differential for my leukocyte count. I have my slide right here with my blood smear on it, my stained smear. So I'm going to put this on my microscope. I'm starting off on the 10 power. This is going to give me an overview of the slide and what I'm looking at. So I'm going to get that into focus. I'm going to start on the end of the smear that's the thinnest. So while I'm on the 10 power, I'm just kind of looking at an overview of my slide. I can see the quality of the slide and of the smear and the stain. This will also give me an idea if there are large leukocytes clumped at the end of the smear. It would be because the pusher slide pushed all the larger cells towards the end. If I see that on the slide, that's going to tell me that it's not a viable slide and not one that it will not give me an accurate read. So I'm checking to ensure that they're distributed evenly. The stain is distributed and going to allow me to see clearly, checking for any large debris that might be on the blood smear, anything unusual or abnormal appearing. I'm starting at the thin end of the slide and I'm just working my way down, working in a grid pattern. I've seen two instances where the red blood cells are a bit clumped. So I'll just make my notes over here. Mild red blood cell clumping. Work my way about halfway down the slide till I'm not really able to see clearly through a single layer of cells. I'm not seeing any large, unusual debris in the slide or unusual cells in the slide. So I'm going to go ahead and turn to my 40 power. Make sure we're adjusted properly to allow me to see through that. I'm going to go back to the thin end of my smear. Get adjusted to where you can see. So this is allowing me to better see the cells. I can see especially the platelets better at this point. Well, this will allow me to get an accurate platelet count. Get that down to the thin end of my smear. Make sure I'm focused. So at this point I'm going to go to where there's a single layer of red blood cells that I can see, and I'm going to get my platelet count. So I have right here when I'm doing my differential, I've got a counter. I'm going to keep track of my leukocytes as I'm doing this, so my white blood cells, I'll just keep track of every one until I get to 100. Over here I've got my chart. This is where I'm keeping track of the kinds of white blood cells that I'm finding on here. I'll record my platelets here. And I also got a spot for other notes, and then my nucleated red blood cells to record and keep track of those. And then the white blood cells that I'm looking for the neutrophils, eosinophil, basophil, monocyte, and my lymphocyte. So I can record each kind of those on here. I'm just keeping a tally mark of how many of each kind I find till I get to 100 white blood cells, and then I'm going to be able to record these in a percentage. So that's what I keep in my record over here, where I can keep track of what I'm looking at there. So as I'm looking on my 40, I'm able to see my platelets. I also can see my stain a little better, make sure it's evenly distributed. At this point I would be able to tell if my stain were not adequate, and I would be able to restain or get a new smear and restain that smear at this point. But with this smear I can see everything I'm needing to. Again, I'm checking to make sure that it's not just the large cells at the edge of the smear, but that they're all even. I'm working halfway down my slide again. So what I'm seeing on 40 power is showing me that my stain is allowing clear and consistent view of the cells, both red blood cells and white blood cells, and that my smear is also accurate and even all the way across. So right now I'm going to go ahead and put a drop of oil on my smear. So I have my oil right here. And then I'm going to turn my microscope to the 100 power on my oil immersion lens. And then this is going to allow me to get my accurate count of white blood cells. So I'm using my oil immersion lens now. 100 power. Get it back into focus here. Okay, so now I'm going to get to a spot on my side where I can see, on my slide, to where I can see through and get an even counting. Alright, so here I've gotten to a spot where it's a single layer of cells. Make my light a little bit brighter here. Okay, so now I can kind of see what I'm looking at a little bit better. So I'm going to start again on one side of my slide where it's thinner. And the oil is allowing me to see a little bit clearer what it is I'm looking at. And I'm just going to start counting the white blood cells I see, as well as keeping track of my platelet count. So for counting my platelets, I'm going to count what the number of platelets I see in 4 fields and keep track of that number, and then I will be able to calculate from there what my platelet count is going to be. So I'll start with where I'm at right now and just count my platelets. So there's 8 platelets that I'm seeing in this field. That's on my 100 power, my oil immersion lens. So I'm going to move down to the next field now and get another platelet count. Okay. I'm seeing 6. No. 8 platelets in this field also. So we'll go to my third field and get my platelet count. And I'm seeing 10 in this field. So I'm also watching as I'm getting my platelet count. None of my platelets are clumped. If it were, I would want to note this in the record and say that my platelet count may or may not be accurate due to clumping. But I'm not seeing that in this case. Alright, so then I'm going to start counting my white blood cells. I'm going to a spot where there's a single layer of red blood cells, they're not overlapping, and I can see the white blood cells through them also. Alright, so I'll just work my way across my slide in a grid. Here I have a neutrophil, so I'm going to mark over here, one neutrophil, keep track. Basophil. Lymphocyte. Neutrophil. Monocyte. And lymphocyte. Neutrophil. Neutrophil, basophil, eosinophil, lymphocyte, neutrophil, lymphocyte, and monocyte, neutrophil, eosinophil, lymphocyte, as I'm going, I'm also keeping track of my nucleated red blood cells and marking down when I come across those also. I have a separate tally where I'm keeping track of them. Lymphocyte, monocyte. Neutrophil, eosinophil, monocyte, basophil, eosinophil, monocyte, lymphocyte. Basophil, neutrophil, here's a spot with my red blood cell clumping. It makes it a little harder to see what I have in there. Monocyte. place on my slide where it's a little bit thicker. I'm getting more in one field. Neutrophil, lymphocyte, monocyte, monocyte. Basophil. Lymphocyte, lymphocyte. Neutrophil, eosinophil, monocyte, lymphocyte, neutrophil, and neutrophil. Lymphocyte. Neutrophil, eosinophil, lymphocyte, monocyte, lymphocyte. So I'm counting. I'm also watching for any abnormally shaped cells. Not keeping track of only the number, but also the morphology. Making sure they are normal in appearance and size. Here I see a small section of platelet clumping. Make note of that. I'm at 65 now. Keep counting until I get to 100. Eosinophil, monocyte, leukocyte. Here's another spot where my red blood cells are slightly clumped. So I'll just mark that. Eosinophil, lymphocyte, neutrophil, lymphocyte. Okay, so one more. Neutrophil. Okay, so that puts my count at 100 for white blood cells. I've been able to keep track of which one is which as I'm doing my count. So what we're going to do now is we're going to take the numbers I have here, put it into a percentage, and then find my absolute value based off of the numbers that I've counted here, and then we'll go over the type and the number, and I can show you some pictures of what we're looking at. So we've completed the microscopic exam of our leukocyte differential. So what we're going to do now is go over some of the cells that I was seeing under the microscope and what an increase in these numbers might be caused by. So the cells that we're seeing microscopically are the neutrophils, eosinophil, basophil, monocyte, and lymphocyte. Those are the 5 types of white blood cells that we're seeing microscopically. So here's a diagram of what each of those cells looks like. We can see our neutrophil kind of has the lobed kind of nucleus with 4 different lobes and a distinct cytoplasmic area. And then our eosinophil has its 2 distinct lobes, and it's smaller in size than some of our other cells. Next we have our basophil. These are the ones that are least commonly seen. They have a nucleus that's not lobed and a little darker in the center. Next we have our monocyte here. The monocyte is the largest of the white blood cells that we'll see microscopically. And then the last is the lymphocyte. It has the largest nucleus in proportion to the rest of the cell and is a solid center. So those are the 5 types of white blood cells that we're seeing. So when we're seeing these cells under the microscope, we're looking for an increase in the numbers that are going to tell us different things. An increase in the neutrophils is going to be due to a bacterial infection or inflammation or necrosis, dying tissue. And some leukemias will cause an increase of the neutrophils. When the lymphocytes are increased, it's usually due to a viral infection or some bacterial infections or a lymphoma. When the monocytes are increased, it's due to a chronic infection, a heart infection, or irritable bowel syndrome, irritable bowel disease, or vascular disease are going to cause an increase of the monocytes. When the eosinophils are elevated, it's usually due to allergies or asthma or a drug reaction or a parasite infestation or an inflammatory response. When the basophil is elevated, it's due to an allergy or a chronic inflammation such as arthritis, or some leukemias will cause an elevated basophil level also. So we have right here the results from our differential and the numbers of what we're looking at. So I'm going to go ahead and show you now how to calculate our absolute values. So the first thing I'm going to find is my platelet count. So I've got all my results right here. So in order to find my platelets, I'm going to take the averages of my 5 fields of my platelet counts. So I'm going to take these averages. So my fields were 8, 8, 10, 12, and 12. And then I'm going to divide it by 5. Okay, so I'm going to use a calculator for all of these calculations to make sure we can avoid mathematical error. So 8 plus 8 plus 10 plus 12 plus 12 divided by 5. 8 plus 8 plus 10 plus 12 plus 12 is 50, and then I'm going to divide that by 5, and that's going to equal 10, and then I'm going to take my average and multiply it by 15,000. So times 15,000. And that gives me 150,000 for my platelet count. Okay, so that's my platelet value. So then I'm going to move on. The next thing I'm going to find is my corrected white blood cell. So my formula for finding my corrected white blood cell is going to be my nucleated red blood cells times, and here we've got a couple equations, 100 divided by the sum of our nucleated red blood cells plus 100. Okay, so when I bring that down, the value for my nucleated red blood cells in my differential was 19. So I'm going to have 19 times 100 divided by 190. Okay? So I'm going to take my 100 divided by 190 and get that answer first. I'm going to clear my calculator. So 190 and 100. I'm going to have 19 times 1.9. And that's going to be 36.1. So that's my corrected white blood cell count. So then I'm going to go ahead and find my absolute values. So starting with my neutrophils, my percentage was 28%, and to find the absolute value, I'm going to take my percentage and multiply it by my corrected white blood cell count. And that's going to be in the 1,000. So I'm going to take my number, I'm going to have 36.1 times 1,000, and that's going to be 36,100. So 36,100 times 0.28 and my absolute value for neutrophil is 10,108. Okay, for my eosinophil, my percentage was 21%. So I'm going to take 36,100 times 0.21. that's going to equal 7,581. And I'm going to keep going with my basophil, which was a 5%. 36,100 times 0.05. And that equals, for an absolute value, 1,805. Okay, next I'll do my monocytes, which was 20%. So 36,100 times 0.2. And that equals 7,220. And then lastly, my lymphocyte, which was also 20%. 36,100 times 0.2 equals 7,220. Okay, so those are my absolute values for my white blood cell count. So that's finding my absolute values and my corrected values for my leukocyte differential. So I can record these into the patient record and let our doctor know what our blood result was, and that's it for our leukocyte differential.